Hi, everybody. So here tonight, Jope, I'm Dr. Christine, and we are waiting to have Dr. Margaret join us. So let's see if she is able to come. Dr. Margaret is an expert in Frenchies, and she is going to discuss with me joint health for our favorite Frenchie. Let's see if it worked. Ah,
Hello.
hi. Can you hear me?
I was going to say good morning, but it's good evening for you.
It works. Yes, because do you want to remind us where you're tuning in from?
Yeah, yeah. So I am in Indonesia right now. So it is currently 6:30 in the morning on Friday.
So, how is that going so far? Is it a good morning or a nice
Um,
day?
yeah. But I will say, I don't know if this is like a thing that I feel like is a universal truth that if your smoke detector alarm is going to go off with a low battery, it's going to happen at like 1
No,
a.m.
that sounds
because
ideal.
so we're like at 1 a.m. trying to get the smoke detector down without a ladder. It's good times.
So,
But yeah, happy to be here this morning with you.
yeah, I appreciate it. So I was saying that we're going to be talking about your favorite cups, Frenchies, right? Um, Going over joint and joint health and also IVDD, right? Is that we say it in English? Yeah.
Yeah, 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 yeah.
Okay,
Yeah, intervertebral disc disease, IVDD.
correct.
Yeah.
Um, so maybe we could do a quick, like, how we met and ended up talking. And I also know you have an adorable Frenchie called Friday.
Yeah. Yeah, so I had learned about Jope on another talk that I had gone to, and I had already been seeing ads for your supplements, so it was already kind of popping up in my feed. And one of my Frenchies had at least fairly minor IBDD incident where he didn't need surgery, and that was about a year ago at this point, and he's been recovering mostly, but he still has like his one gimpy leg where you can tell like every once in a while you're like, oh yeah, something's not quite right.
Mm.
And Jope sounded like an interesting product as far as the research goes on it. It's definitely different than anything else I've seen out there, and so I decided I would give it a try. Yeah, and then we've kind of chatted ever since, and I think it has some cool implications as far as, being useful for healthy dogs and hopefully helping keep them healthier. I think Frenchies are definitely prone to joint issues because the spine itself is technically a joint. It's made up of some cartilage, it has some joint fluid. So when we talk about protecting the joints, we're also talking about protecting the spine, which is super important for them.
Yeah, and I think that's it is a very good way to start the conversation and reminding that the spine I think sometimes we just forget because it's such a different joint compared to just our, I don't know, our wrist or our shoulders. So yeah, I think that's a very good thing to remind people about. And what did you think we should start with tonight? I know I was super excited to chat with you. My brother has a Frenchie Chi Chi too. Is very active so far. He hasn't had any episode of this disease. So we're on wood,
Yeah.
and don't have him jump on anything. Try
Yeah.
to avoid jumping. Just be like really careful. And he's taking Job too because he's young. How old is Friday? Remind me.
He is 5.
Okay. Yeah, Chi Chi's probably he's 3 actually, so slightly younger, but very
Yeah.
active.
Yeah. Awesome. Yeah, I think it would definitely be awesome to hear, I think, a little bit more about like the ingredients that are in Jope and why you chose those specifically.
Yeah, and we had some questions, right? Because we promoted this
Yeah.
live.
Yeah.
So we'll be answering these two, which we, are excited to be able to answer some very specific questions. And if there's more that come up, thank you everybody for joining too. I see that there are a lot of questions, and we'll do our best to answer them. But if I forget one or two, maybe we'll post in the comments after as well. So the joint, our joint supplement. So it originally it started because I had a dog Pepsi who suffered and battled arthritis, and so I went into a very deep like exploration of what are the supplements out there, how can I help him, because he wasn't reacting that well to NSAIDs, which are drugs, anti-inflammatory drugs. So I really went down a rabbit hole, and that's how I found the ingredients that are in our chews now. And that's UC2 collagen, which more people seem to be familiar with too. It's this very specific type of collagen. Also omega 3s, and then curcumin from fish oil. So they all act together in a very like nice complementary way where we have UC2 collagen, and we can go into it probably a little bit later, like more detail, but basically it has two-way of acting to help joints, generally speaking, by reducing inflammation in a natural way, and also helping with maintaining like healthy cartilage, which is something we're probably going to touch on when we're talking about the joints of our Frenchies. And then we added omega 3s because these, omega 3s, I'm sure you will agree, is probably the ingredient that is the most studied and has the most robust data to support efficacy for joints specifically. So that's why we decided to use it. It acts differently than UC2. And then we included also curcumin for the antioxidant properties, because when you have, a general like inflammation that you can have with arthritis, where it's not going to be just one joint, but it can be present in the body, it's nice to have, an ingredient that's going to address this, and help with, free radicals, and just helping having a healthier environment in the entire body of our pups. So those are the three main ones that we have. Oh, and you're seeing my big warrior. Sorry. I was like, ooh, who's this behind me? Who's this handsome man? So this is the perks of, doing calls from your home.
That's awesome. I know we're pretty bare bones still. Haven't put anything up.
I'm doing it in a way,
Oh, too funny. Yeah, that's awesome. Yeah, I would say definitely, obviously, the omega fats and fish oil are always kind of top of the list for people, and I definitely agree. Super helpful with joints. And you hit on kind of the inflammation multiple times, and that again is like a huge part of the intervertebral disc disease cycle. So, when we think about disc disease, we're basically talking about these cartilaginous discs that live between the spinal vertebrae, and they're kind of your cushion. And they have this outer ring of cartilage, and then the inside is kind of this like gelatinous material. And so in disc disease, we see that gelatinous material kind of like either bulge. So sometimes you'll hear IVDD referred to as like a bulging disc, or as like a herniated disc. So that disc will like bulge out or it'll push on the cartilage in kind of the lower stage IVDDs, where they just push up on the spinal cord and compress it. But sometimes we'll see it essentially like leave its little cartilage capsule. I've heard it described as like exploding in Frenchies. Um, and so that's one of the things where we see a ton of inflammation. And you get like this bruise on the spinal cord. So anything we can do to increase or decrease inflammation, especially during an IBDD crisis, is super important.
Yeah, and you in a very good way. I was actually like, reading again, being like, how do you explain a disc? And also there's a lot of different types. So
Mhm.
but I guess the best way is like, yeah, you said it really well. You have these cushions, and then they change. It's kind of like they change form, right, for different reasons.
Yeah.
Yeah. And,
Yeah, Frenchies are definitely prone to them like degenerating a lot sooner in life. So in like in other, we can see IVDD in other breeds, even like not we see the typical like corgis and dachshunds that have the long backs, but
Yeah.
even in any breed is prone to IVDD, mostly as a senior though, just because they've had a lifetime of those discs breaking down. But in Frenchies, we're seeing them degenerate massively early. So we're seeing IVDD at a year old, 2 years old, where they already have multiple discs that have degenerated or are at a risk. So
Yeah, and treatment I think also is probably worth mentioning, right? Because sometime you're gonna do conservative management like you did with Friday.
yeah,
Sometimes you also do need to do surgery,
yeah.
right?
Yeah. So I'd say the general rule of thumb is like ideally, if you have the money for it, if your dog has paralysis, so like significant neurologic signs where they really can't walk, then surgery is the ideal treatment. If they're still at a phase where they're walking but just have some minor deficits, then a lot of people will choose conservative management at that point. But I will say I am a huge advocate of conservative management, especially if people don't have the funds for IVDD surgery. I think a lot of times we don't give it enough of a chance and we don't give it enough time. Like I said, with that, like bruising can take a month to resolve. And so you can slowly over a month see them return to function. And so my feeling on it is kind of like, if we can control the inflammation, control the pain, and that, if they're clinically getting a little bit better day by day, and they're not painful, that we should give them a chance. I think unfortunately, there's kind of a jump to euthanasia a little bit too soon a lot of the times, just because it is super scary. And so I think if you don't know about it and you're like, one day your dog just wakes up paralyzed and you take them to the vet and they're like, well, they might get better, but probably not, and euthanasia, is an option. I think a lot of people pick that because they just don't have an understanding of it and it's super scary. And I totally get that. I'm hoping that I can advocate for people knowing more about it and hopefully giving their dogs a little bit more of a chance.
No, and I think that's a very fair point. I mean, so far I've only seen it, in the being like in the practice when he comes in and the dog is non-ambulatory and usually
Mm-hmm.
it's at a presentation and it's very, very stressful for everybody.
Yeah.
But I do think what you're saying makes sense, and you've lived through it too, with Friday, and then probably seeing it in practice as well. So if somebody is thinking about conservative management, just giving rest and decreasing inflammation, there's different things that you can do, right? You did a lot of acupuncture.
Mm-hmm.
But what else did you like? Would you recommend overall? And then we can talk about supplements and how that could fit in. I do want to say, like, full disclaimer, our product is meant for joints and disc. Although we did say, at the beginning, it's a joint. The study we based the kind of our ingredients in our formula were on joints from the limb, but we can certainly talk about like disc and how it could potentially help. I just want to say that not necessarily the studies aren't there yet, at least when it comes to
Yeah, we're definitely kind of doing some
yeah.
extrapolation, correlation. Uh, yeah. So during Friday's recovery, I did a ton of acupuncture, especially the electroacupuncture can be really helpful, just to like send those neural signals to the legs to try and get them going. And then laser therapy, so using the cold laser at the vet can be helpful as well. I also really like the Assisi loop, which is a pulse electromagnetic field therapy. It's FDA approved, so there's pretty good research behind it, that it does decrease inflammation, and even with IVDD, that it helps return to function. So that is definitely one of my like absolute favorite at home products. And then yeah, rest is just like ultimately the biggest thing, especially with those really early or like early stage IVDDs, because with that ring, and you can see like kind of the bulging, you can even get these little like tears in the outside of that cartilage ring. And so it might be like there's just like a little bit of that inner gel that's kind of like pushing out. And if you rest them, and are really diligent about it and give them the time to recover, that cartilage disc can repair somewhat, but they're not well vascularized, so it just takes forever. So that's definitely like you. I think there's spaces where you can you can, fingers crossed, stop them from like progressing if you give them the chance at rest.
Yeah, and I had actually, it's reminding me that I had a neighbor who had a corgi, and it happened to his pup. I think it was an acute presentation as well. Like basically one day got up, his pup
Yeah.
couldn't move anymore. But he got better as well with a lot of cage rest.
Hmm.
Can afford surgery, but it took a long time, and it's a lot of patience,
Yeah.
for sure. So, and I think adding a joint supplement is, it can be an option. There's not that many that some research after we chatted, and I know
Hmm.
one was mentioned in the question with Frenchies, right? The one for disc. Uh,
Yeah, the
yeah.
yeah.
Is that one you've used, or is that something it was just from a question, or have you
Yeah,
used?
it's not one I've used. It was just one of the questions that someone
Yeah.
had submitted, and it's definitely a supplement that I've seen talked about a lot.
Yeah, and I looked it up. There's a lot like in that specific. So, supplements for, I guess, for disc disease, I was thinking about it. I think it's worth trying, like you said, because if you're not going to go to surgery, and so I'm going to be more so addressing right now, like probably an acute presentation, right, of disc disease, not so much so if your dog seems to be doing well, but I guess in the acute phase, it's worth trying because it can help. And then with, proper, if you choose a joint product that, you've done research on, and in our case, for example, we really chose ingredients that are going to help, again, limit inflammation in a kind of ongoing way. I do want to be careful when I say like limit inflammation because it takes time and it's not a drug. But what it's doing is that it's training the body to have a healthier inflammatory response and not a negative one or a degenerative one. So it can help have like a healthier joint environment. Other joint supplements are also potentially going to do this. I think it's important to look at the ingredients. In our case, the ingredients again have shown to just help maintain a healthier joint. So I would say it's worth trying and seeing if it's going to help. There's no studies again that have really demonstrated like a correlation with the joint supplements and improvements in dog that have, acute presentation of intervertebral disc disease. And so I would say just, try it, worth monitoring and being careful with it. If you have a breed that's just predisposed, generally speaking, to potential joint disease down the line, it's also going to benefit them. Specifically, thinking about our Frenchies that have very short bones, and they didn't have necessarily the same kind of growth patterns as other breeds. Um, that can certainly be beneficial for them in the long run too. To start, early and be able to provide supplements that have been shown to help with, maintaining healthy. Um, I know it's maybe frustrating because I'm not able to give like a yes, it's going to work. I think it's worth trying and then, reporting back. If somebody is curious and wants to try it for their dog, and like we're happy to, monitor with them. We offer a tool, so a form that you can fill up online, and then we send you a personalized form to track progress. So I would say if somebody has a Frenchie and unfortunately they have to deal with intervertebral, sorry, I'm struggling, my French, disc, and they want to reach out to us and give it a try. I'm not making any promises, but we can certainly try to help and help them monitor as well,
Mhm.
through that form that we can help send.
Awesome. Yeah, that's awesome. Thank you. I got asked the question like, how many supplements are too many supplements? Which I was like, this is a great question because I feel like even I'm overwhelmed sometimes with like the amount of things that are out there. And I would say like, I don't know if you agree with this. My typical answer is to like that you really have to look at the ingredients of every supplement you're giving and try and have like a reason behind each one, you know. So if you're like choosing, and there's some of the supplements out there that have like 20 ingredients, you know, and so it's like looking at those and saying like, okay, which ones of these does my dog need right now? Are they at a level that's effective? Yeah, I don't know if you have thoughts on that question.
No, I agree. I'm like saying yes with my head because uh, is so too many sub. Can you too many sub? I do. The answer is yes. And can you give supplements that have everything or seem like they have everything, but is it really helping? I would definitely say probably not. So I when I practice, what I really like to do is get to know the patient and get to know their lifestyle, their breed, their what are they eating, their diet, what happens to them in their life. Important when you're choosing supplements to choose the ones that are going to be most beneficial. And I would like we prefer with Jope, we're doing a very targeted approach. So we want to have supplements for different long-term chronic diseases or problems you can face with health to help address them and also help support just their management. But very targeted with a limited amount of ingredient, like you said, because if you put too many ingredients in a product, you don't know how necessarily they're going to interact. And most likely, if you want to make a product that is not going to be too expensive, you're going to have to be kind of cheap, quote unquote, on the amount of ingredients you're putting in there. And so I would be concerned about the quantities and the efficacy. So, I would always recommend first of all, think, which supplement could benefit my dog most and why. Are they younger? Are they older? Are they a breed that is at risk of a specific disease? And then take the label of the supplement you're considering or you have and read it. How many active ingredients? What is the dosing? What are they putting in there? And kind of choose it and always like ask, for example, us, right? Or you talk to, I'm sure, pet parents very often. I'm sure you'd be willing to help. Does this supplement look good? Does it seem safe? Where is it made? There's a lot of criterias, and sometimes there's so much out there that it can seem just very overwhelming.
Yeah.
But that was when I saw the Vitri Science one too. Actually, the disc of I think it was Vitri Science. It sounded very interesting, and but it did have I thought it had a lot of different ingredients, and I wasn't too sure about how they all work together. But maybe you saw that too, or you have more experience. I saw they had a lot of different ingredients in there, and I wasn't too sure about the dosing. But I'm not an expert in those specific ingredients.
Yeah, like yeah, like I said, it's not one that I've used personally.
Yeah,
So I don't have like a ton of thoughts on that one in particular. I do typically like the Vetri Science brand. They're generally typically well made and contain what they say they contain, which is nice. So
yeah.
yeah.
That's where you're referring to is like label quantities and testing,
Yeah,
right?
yeah, just because the supplements market, I think, for dogs and for people is one of those like kind of wild west sometimes. And unless you know that there's like third party testing going on, or that they're kind of actively seeking certification to show that they're, creating a good product. Definitely see supplements make some wild claims. And yeah, and then I think, find out all the time that like, oh, this didn't actually have some of the ingredients that it was supposed to have, or, it doesn't have any of the benefits that it's supposed to.
Yeah.
Yeah.
And that's very unfortunate when it happens. And the third party testing, I think, is one very important. And everybody should be doing it because you are setting something based on certain ingredients, so it is important to check. Um, And you can ask the company if they do it.
Yeah.
They should be able to tell. That's
Yeah, yeah, for sure. Yeah, it's always interesting when you ask companies questions like, I'm like, this should be an easy response. Should be, a yes or no, or like, this is what we do, this is what we don't do. And they're like, oh, it's proprietary. We can't let you know any of like, I'm like, red flag. So, yeah, I think that's a great idea is like, if you are questioning, like, oh, is this a good supplement or not? It's always a good idea to reach out to them.
yeah. If you have specific documents you want to see, like email. We know it pretty often actually, which I'm always surprised, but I think that me are aware and they're very careful as to what. Um, so
Yeah,
feel free
awesome.
to. Did we have anything else that we wanted to touch base? I saw some questions, I think, but I think you maybe had some more, or
Out for a minute there.
I was asking if we had more questions that we wanted to go over.
Yeah, I did get asked like what your thoughts on glucosamine and chondroitin are. So that's obviously one of the big supplements, and then green lipped mussel as well.
But yeah. Yeah, so I think if we move away a little bit from this disease, because again, I think that that's a little bit of a hard one. But if we're talking about joints in general, with that, there's more studies on it. There's a lot of studies on dogs with arthritis and how different ingredients can help them. And there are more and more studies on glucosamine, chondroitin, UC2, omega 3s. They're all available on PubMed too. So you don't have to just believe what I say. You can go check out for yourself. Um, but glucosamine, chondroitin, I think, they were the first ingredients on the market for dogs. Like they probably started becoming more popular in like the 1990s. And so they are very popular. There's a ton of products that have glucosamine and chondroitin. But a lot of the more recent studies are just showing that unfortunately they're not as effective as we once thought. And also not all glucosamine are equal because you can have a lot of different types and a lot of different origin. And so, depending on the brand you're going to choose, you're not necessarily going to get the same quality product. So I would be very careful. And if you do choose a glucosamine or chondroitin supplement, I just make sure that, I'm checking with my vet to make sure that the quality is going to be there. I'm not a fan of glucosamine and chondroitin personally because the studies, again, I think very disappointing. And again, they're available on PubMed. The conclusions are that it doesn't work like we thought it did, and basically placebo or similar effect. And there's newer ingredients, such as, for example, green lip mussel, which studies on certain products. Again, certain products are going to have studies behind, and they're showing very good results. I also have a preference for the green lip mussel. There's some that are powder and other that are oils.
Mhm.
And I don't know what your thoughts are, but oils are definitely the ones that are, I think, the most beneficial because they're going to be very pure and they're going to be the most potent when it comes to helping with joint health. So that would be my thought on two ingredients. Uh,
Oh,
there,
thank you.
um, and we have, I think we had a few questions too with what are the main supplements for dogs with IVDD that we should focus on. That's a hard one for me, honestly, because I don't know any off my 100% comfortable recommending. There's no studies on
Yeah,
any that I right.
yeah, it's all kind of like piecemealing from other extrapolating well, this has this benefit for other things, so hopefully it has a benefit here. Yeah, definitely doing a lot of that. So
So I don't have a specific answer. I think talk to your vet, look at a supplement towards like IVDD and make sure you're checking which company you're buying from. I think those would be my recommendation. Just checking. So I'm spreading the love because I'm not saying this. I think you're careful with using as decide why you want to choose that specific ingredient or product.
Yeah, for sure, for sure. I see. Well, there's one question on my screen that says any supplement recommendations to slow tumor growth, which isn't necessarily this conversation, but I would say for sure turkey tail mushroom. There's some pretty good research, so check that out.
I
Um,
did not know that.
yeah, yeah, it has some really cool like anti-tumor factors. And oh my gosh, now I'm gonna like totally blank on the name of the company. But there is a company that did a study on hemangiosarcoma and survivability, and they showed that their product, it's like I always confuse it with the like you move one. It's not that one, but it's something like that name. But yeah, if you Google like hemangiosarcoma, turkey tail mushroom supplement study, it should come up.
It's pretty good to know that. I think that's what I do like a lot about the joint, like not the joint supplement space, the supplement space in general these days is like there is are companies putting money and investing in studies, which is because that didn't used to happen, as much before. And we're actually launching, if I may, we are launching a double-blinded placebo-controlled trial study too. I think I shared that with you, right? Uh, so
I don't know if you did yet, but that's awesome.
yeah, we're going to enroll 60 dogs, and fingers crossed, we'll get results in a year. So patience
Perfect.
is
Yeah,
key,
we'll be patiently
but
waiting.
very excited about that
Awesome.
as well. Yeah.
Yeah, cool. Oh yeah, I did get asked like for a healthy French bulldog, what timeline would you suggest like starting a product like Jope?
Yeah. So, Frenchies, again, French bulldogs, they can be just prone to having joint issues down the line because of the way they grow and their bone structure overall. So, honestly, for these breeds that I would consider at risk of joint disease, I would say as early as possible and probably like 12 months of age,
Mhm.
just to be on the safe side. And so, the reason you want to do that is that you're going to help with micro trauma when that happens regularly on a daily basis. Like we were talking about, Chi Chi, that's my brother's friend dog, who's very just excited and energetic. You're gonna have regular joints, and also the way they grow makes that their joints are not necessarily gonna have the exact same structure as like other breeds. So
Mhm.
start early. And in the case, kind of to explain also why we chose UC2, UC2 collagen. It's a type of collagen that is patented. So it's a guaranteed quantity of ingredients. And it's the only supplement so far on the market that has a study that was made in young, healthy dogs to show that it helped improve performance, so running, and also recovery after exercise. And they showed that in these dogs that were healthy, they inflammatory markers called interleukin 6. And so that is a sign that it's helping overall, even if you have a healthy dog. I'm biased. I saw my dog suffer from arthritis, so it just start as early as you can, and they can't walk anymore. It's late at this point.
Yeah.
But that
Yeah,
goes,
I think that's super cool research. And yeah, I definitely like in my brain, I just see it as like, okay, the ring is made of cartilage, and so if you can give the body the building blocks to try and repair itself, that's a good idea.
yeah, I mean, it's worth trying for sure. That's my opinion. It's like, unlikely it's going to have any bad effects. I say unlikely, depending on what you're choosing. You want to be careful of the quality, but it can certainly help. And in our case, it's also, just really making sure that you're keeping things just healthy as long as you can, and not trying to repair them when it's like too late.
Yeah.
And for that, I mean, I really would love to be able to do a study one day on Jope and like Frenchies or dogs that have disease. I don't know if I'm going to say, but it would be
Mhm.
super. Or maybe a company, I guess, if somebody could do it, that'd be pretty fantastic. Because the
Yeah.
question does so be hard for me when I'm like, well, I want to be able to give you data, science. I like assume, and that's really tricky.
Yeah, for sure. Yeah, maybe one day I can find you a steady group of dogs for sure.
For me, you're okay. We're like 60.
Yeah. Um, oh yeah, I do have one more question because I know I'm going to get asked this later, which is if dogs have a chicken or a fish allergy, is that going to be an issue with Jope?
So for Jope, no, well, I'm gonna back up. We do have fish oil, but there's no protein in the oil we have. We specifically ask our manufacturer to get a certificate of analysis. So we do that for every ingredient. We ask for the fish oil, and that one has no protein, so it shouldn't be an issue, even if the pup has a food allergy to fish. For the meat, we don't have any meat in our chews. The only protein is and it does come from chicken. But UC2, where is really cool, is that it actually is not absorbed. So in order for it to be effective, it is going to trigger the immune system to be less activated. So it's going to downregulate it, but it's not absorbed. And so the protein is not actually going in the body. It's really training the body to be healthier when there is arthritis or when there is pressure on the joint. So we have a lot of people that are using it. It seems fine. I would just say, if you're very concerned, maybe stay away. But we really have dogs that are fine with it. So, check, make sure you're comfortable, and then you can always give it a try. And if there were to be any like diarrhea or sensitivity, like we'll refund you. And we don't, we can't be for whatever reason his dog is not doing well on it, we will refund and we have 100% satisfaction guarantee. Because if we want to not make your
Yeah.
life basic. So
Awesome. Very cool. Okay. I don't know if you see any more questions in the chat that
about home cooked meals, I know a lot of people talk about home cooked meals, and I think true, if you're able to do it, I think it's amazing, right? Like a balanced, well thought and
yeah.
home cooked meal. But
Yeah, I would say for sure, yeah, be careful with the online space again. If you're just like finding a recipe on Pinterest, say like 99% of the time they're not balanced. And be careful with who you work for because that term like canine nutritionist isn't like a regulated one. So, you know, choose who you work with a little bit of caution. But yeah, I'm definitely a fan of home cooked if you have the ability. And there are like more brands. I feel like every month coming out with fresh food that you can order and gets delivered to your home as well, which is awesome.
But I do like I think we can't emphasize enough how important it is to really, like, be careful to choose balance. Like balance is the word for
Yeah,
any diet. So uh,
yeah,
like I'm a big proponent of food feed your dog whatever you're comfortable with, but please 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 check that they're getting what they need because that's really just like the most important at the end of the day. So
yeah. Yeah, definitely. And like on the note of we'll say of supplements is like I see people all the time. They're like, well, I give a multivitamin, so that's gonna like fill in all the gaps. And again, like that is there's almost never enough calcium and never enough trace minerals. Like when I created some diets for people, and it's almost always like you're adding in a little bit of like a few different supplements because you're just not going to meet their needs with one multivitamin, unfortunately. So just be careful, work with someone trained.
and that goes back to the question of supplements and quality and too many is
Yeah.
just really choose them. Look at what is in them. Like any supplement, whether it's for I don't know, skin, health, like look at what you're choosing.
Mm-hmm. Sure. Sure.
Okay, well, I think that's it on the if I didn't forget anything.
Yeah.
I think
I think you're good. But yeah, feel free if you guys watch this later, have more questions, comment, and one of us will try and get back to you.
yeah, you can leave messages in the comments or direct message to Works. So yeah, thanks for being here this morning, tonight, wherever you are.
Yeah,
Very,
thanks for chatting.
yeah, I'm sorry to hear you didn't sleep that great, but
It's
I was
okay.
very and super excited to just get to meet your community too. I hope the questions I answer them, in a structured enough way. Sometimes it's hard to give answers, so if something needs more clarification, just leave a comment.
Sounds good.
Now let me
Awesome. Thanks so much.
talk with you soon.
All right,
Bye.
thanks. Bye.